Yeah, sure. Well, first of all, this is, I would always tell my folks, we hope we get a vaccine, but you should definitely not count on it because it's ambitious. It hasn't happened before. So the fact that it is, that's a great testament to Operation Warp Speed and all the work that so many people have done. So we couldn't, as soon as the Pfizer news came out, I flew up and met with you on Warp Speed, and I told my folks, we already been planning for it, but I was like, we got a better sense of the timeline. Let's make sure that we're leading from the front. We really wanted to embrace this. I know other governors have said this may not be good. We view it as a good thing, not forced for anybody, but offered to all. And we basically did our vaccine plan to flow out of our normal mitigation plan in terms of we focused on protecting vulnerable populations, whether it's in nursing homes or the broader senior population. We focused on supporting our healthcare system, and then we focused on making sure kids were in school, people were able to earn a living. And if you look at what we can do with nursing homes, we could have every resident of nursing home and long-term care facility vaccinated in the month of December. I mean, that's within our grasp right now in the United States. In the state of Florida, we have 4,000 facilities. We're working with CVS, Walgreens to be able to do that. It's important for saving lives because they're the most vulnerable, but most of them who get it do survive, and then many obviously have not been infected. But it has such a devastating effect to have mitigations going on in these. Look, we allow visitors, but you have to take all these precautions. You just can't live normally, and it's taking a huge toll on these folks. And so we see loneliness, despair, even with having some visitation. So we need to get them back to normal, and getting them back to normal is going to mean so much to those residents and their families, and I'm thrilled that we're really on the doorstep there. And then in terms of the healthcare system, look, the models that said that we're not going to have beds, tens of millions of hospitalizations, obviously those were very, very wrong. But what we found, particularly over the summer when we had a higher census, it wasn't that we had plenty of beds, but this is very labor intensive for healthcare staff with the isolation procedures, everything they've got to do. Obviously, they're testing everyone that comes in, so someone breaks their legs. They may be asymptomatic, but you still got to do the procedures. And then an exposure could take out a half a dozen nurses at one time. Well, to be able to get it through, offer it to our healthcare systems, their tip of the spear, high contact workers, to be able to have them, well, they're going to be in a situation where they're going to be able to handle patient load going forward. And so I think in terms of the most at-risk population, we'll be able to target first, and then simultaneously the kind of the high contact, which would have the most impact on our healthcare system. And then we think, based on the numbers, at the end of December, we can start getting it out into the broader senior population, and then January really focus on vaccinating as many elderly people as we can. And so we're really excited about it. We really leaned into it, and then we thank everyone for doing it. This is a really, really significant achievement for our country. Yeah, I think communication is important, and I know a lot of our hospitals are already planning on doing a lot of very robust outreach, but this was the first vaccine that's really been politicized, unfortunately. I mean, you guys remember the campaign, and that's going to be something that people are going to have to deal with, and we obviously want to deal with it. I think the fact that we're not threatening to mandate it helps, because we say, look, we think it's important, but obviously you make the decision. But and then I also think just some of the bad messaging that's come out over the course of this, quite frankly, is problematic. I mean, when people are doing some of these shutdowns that are totally unscientific about this type of activity, or being on a playground, or schools can't be open, then I think people look at that. So I hope we can kind of get on the same page here, take the politics out of it, be very consistent, be evidence-based on it, and I think people will respond positively.
Do you mind giving us the last word on how you're thinking about prioritization, how you're thinking about which groups you try to stack as we roll vaccines out?
Yeah, so I mean, obviously, we're prioritizing long-term care residents and staff, and then tip of the spear healthcare workers. As we get past that, which we think we can do with the first a couple weeks of doses that were allocated, get into the broader senior population. We have obviously a lot in that regard in Florida, so that would really take us in through the end of January. And then we're hoping the J&J comes online with the one dose. They're producing it at such a scale. Then we get that out so teachers can get it, law enforcement can get it, and really, hopefully we'd have enough for whoever wants to do it. So that's our hope. But the Moderna and the Pfizer, we think based on our allocations, we're going to be focusing that on high-risk populations and the frontline healthcare workers.